I'm gonna try and talk in about 20 minutes about this entrepreneurship and how this startup is growing. And then hopefully we can count with other guests, other Chilean guests too, that could add it to the discussion and talk about their projects. And if there's any questions, Q&As, please uh, hope you can write them at the chat section where there's a question section, and you can actually write whenever you want these questions that will be addressed after the presentation. So just to start, I'm gonna share my screen, and then we are going to, as I'm telling everyone, we're gonna first see this specific case. It's just an example of how many successful cases and startups are growing and from Chile to the rest of the world and can have a strong impact in Canada and everywhere. So please, again, if you feel you have any questions during the meeting, during the presentation, you can please write these questions in the chat right at the bottom of your screen to the right, and leave those questions. We will address them afterwards. So with nothing else to say, I'm gonna share my screen. Okay. So today, this example of a startup in Chile, I represent in this case the Chile delegation of ProChile. Um, most of my colleagues here in Montreal, they told me that it would be fine to present at least one case and then to start this discussion. And we're going to talk about a little bit about this startup that I have founded. I co-founded in 2019, by the end of 2019, that is growing fast and is succeeding in Chile and in over 8 countries so far. We're going to talk about a little bit about the future of how we learn and acquire skills, and specifically practical skills, psychomotor skills, that nowadays with the boom of online learning is not so easy to acquire. It's not so easy to become, for instance, a surgeon and learn the techniques you need to do surgery just by uh, assisting a webinar or having a very nice immersive experience in a VR world. We need something else. And I'm going to try and expose how there is a problem and how we can fix this problem through this presentation. So my name is Julian Varas, and I'm the CEO and founder of C1Do1. C1Do1 is written like to watch things and then do perform things. So C1 do one in English. First, we would love to understand a little bit about education. And there's a conceptual model called the Miller's Pyramid, where that is used to assess skills. In order for us to assess skills, we need to understand that usually we will first need knowledge uh, beforehand, before understanding what we will do. Let's say we want to learn how to play guitar lessons. So if I want to teach guitar lessons, I will need my trainees to first read about the theory behind music, understand a little bit about how to play A, B, C, D notes and stuff like that. Then we will need to integrate this information so that we will actually be able to understand music. Finally, we would demonstrate the skills. We would need to practice and show this to our teachers. We would practice before the concerts, and the final level would be the concert. This applies to many areas. For instance, I'm a surgeon, and in the surgery field, what you need to do is, of course, you need to read books first. You need to read about the cases, understand how you would treat the cases before you get to patients. Now, the way we demonstrate that we actually have skills is by doing simulation training. So we would try and perform before a patient. We try to train ourselves on simulation basis, and using this type of methodologies, we then go to the patients. But mostly in the world, what is happening is that we are skipping this simulation area and we're going straight to the patient, and that is not so good. The what we would love to do is able to have a learning curve before our patients. So how do we transfer skills nowadays? We need three pillars, and this is after 12 years of doing a lot of research on how to transfer skills. In order for us to acquire practical skills, we do need these three types of pillars. So with the example I was saying about guitar lessons, let's say I want to teach you all guitar lessons. You would need in the first pillar the guitar. You need access to a guitar. And in that case, uh, if I want to teach you remotely, you will need to have access to a guitar so that even if I am from a distant place, you will be able to play in your own guitar. But not only that, maybe you will need a microphone, you will need a very nice room, a very nice facility where you will be playing music. The second pillar is, what are you going to do in this guitar? Are you going to do basic guitar? What is the objective of the program, and which is the minimum competency you want to actually acquire in this training program? uh, how I want my trainees to graduate with what kind of skills. So in guitars, let's say I want to train you in advanced guitar, maybe then the first pillar should be a very advanced guitar. So you do need to focus in this type of things before actually training someone. And the third pillar is very difficult to obtain, and usually is where everyone is failing, and is who is going to provide the feedback, who is going to teach the trainees, who is going to tell a trainee that there's a mistake happening and how to improve that mistake. So as I'm a surgeon, I'm going to show you an example of how these pillars might look in a different kind of scenario in surgery. This, what I'm showing you here, is a first pillar in simulation training at Católica University of Chile. And what we are seeing here is some trainees now are basically on a simulator trying to perform advanced skills. The simulator is the first pillar, but I'm going to show you how we developed a second pillar and how that ended up being a methodology that we later converted into a startup. So the second pillar is this advanced training program, where usually trainees in this type of tissues, they perform very complicated specific psychomotor skills. So usually, in order to train this, many in a traditional way of doing this in a general surgery residency, what happens is you need to expose to a lot of patients. But with simulation training, you can develop a learning curve and decrease this learning curve by training in this kind of gymnasium. So the program we developed is called the Advanced Training Program, and it lasts 16 sessions. And the exercise was as shown in the previous video. And you can see that at first there's a very heterogeneous group. And once they receive feedback in every session, this group can achieve really high levels of expertise. Actually, when you compare previous training to after training, the worst performance from any trainee is much better than the most talented person at the beginning of the training. So the concept of training is much more stable and much better, right, than the concept of talent. Usually general surgery residents would prefer trainees with this type of 16 sessions program than a talented person by itself. And there's another catch here. These trainees are good in the simulator, but are they good on a patient? And that kind of question we need to answer ourselves. So how are we going to demonstrate that, for instance, playing in the simulator means that you will actually be very good in the real scenario? So we asked ourselves that question, and what we did was compared junior trainees, this means interns or just graduated med students that went into surgery, and at their first year, we trained them with this advanced program, and we compared them to general surgeons graduated of over 5 years of general traditional program, but without simulation. And as you can see, trainees that are in this case, that are basically trained with 16 sessions of simulation are much better in performance on real cases than general surgeons that are traditionally trained with 5 years in a 5-year program. So what we were accomplishing here was we were transferring skills, at least with in-person feedback at Católica University in Santiago de Chile, to the trainees that were training in the facilities, and without exposing them to patients, and the learning curve was decreased. So what about the third pillar? I'm showing you this example because usually if in healthcare area, what we do is, instead of having a trainer such as the guy in the back here in the picture who is training these kids at Paris Saint-Germain soccer team, what we actually do in the healthcare area is like asking Messi to go and do the teaching of these trainees, to go and give feedback to these trainees. And it's really crazy. So what I'm telling you is, for instance, in surgery, we would call the best surgeon around, the best clinical surgeon, to go and give tips and tricks to our kids that are learning laparoscopy. But this is not a great deal, right? Usually Messi is very busy. We don't know if he's available. Usually he's never available, and he should always be training so that he can succeed and acquire trophies and score goals all the time. We also have no clue if Messi is a good teacher or not. So is Messi going to give the right feedback? In order to be a good teacher, you also need to develop a learning curve and to understand how to deliver feedback and to train someone. So with this concept in mind, the first pillar, the second pillar, and the third pillar, we realized this is the way we could transfer skills. And if we want to do this remotely, so distance, and why would we want that, is because most trainees they were in the need to travel to Santiago to to get all of this kind of training programs. So the first question we had was, is it possible, is it feasible for us to train someone in Peru, or to train someone in Bolivia, or why not El Salvador or the US or Canada? And we need to address these three pillars. So how did we do it? We created C1 Do1, and this platform, what enables you is to basically have, if I'm going to teach you guitar lessons and you already have access to guitars, we will enable you to have access to a training program, but then also access to digital feedback. And that's the key to basically transfer skills. So as in the example of laparoscopy, here you can watch a tutorial video in the C1 Do1 platform. The trainee will be able to imitate an expert in this tutorial. They have not yet received any other kind of instruction. They will go to a skills lab such as this. And in this case, the first pillar is in this place. This actually is in the US. And the trainee will watch the tutorial, will imitate, and will record himself, in this case, him or herself, right? They will record themselves and they will upload the video to the C1 Do1 platform. Once the video is uploaded to the C1 Do1 platform, it is distributed to an Uberized network of teachers. So the teachers, the experts, are already trained in the platform, but they are also very well trained in giving feedback, in providing specific individualized feedback. And how well they can watch this video, first of all, is asynchronous, so you don't watch it in a live fashion. You basically go to the video, put pause whenever, as a teacher, you detect that there's a mistake committed by the trainee, and you will now try to improve this mistake by writing at the specific moment you discover the mistake, drawing in the screen, putting an audio memo. Also, you can put many assessment rating scales, and you can simply add all kinds of educational tools to improve the experience, so that then the trainee will receive this feedback and will be able to watch his own video, his or her own video, and and go straight to the feedback inputs that are attached to this video, so that they can know exactly when they are committing the mistake and how to improve it. They can also watch video capsules on how to imitate new types of examples of how to improve this kind of feedback. we compared this to the traditional way, and our traditional way was to have in-person workshop where the trainees would come to Santiago de Chile, stay at least 1 or 2 months training with us. That is the control group. And we compared them to the C1 lab system. And in lab is because of the laparoscopy course that I just showed you. So in order to validate this system, we compare them. And the lab system, we were training trainees at different regions in Chile, at Coquimbo at the very north, and also in Temuco at the south of Chile. And the results were really astonishing. We were basically transferring skills remotely and asynchronously. And the good thing was that the quality of the skills acquired were really awesome. And we were very happy about this, not only in quality, but also in procedural time. But trainees from both groups were improving dramatically. With COVID, this became the way to train our trainees because everything was with lockdowns. And as you can see, our trainees had access to this skills lab with protocols, with security protocols, but also the trainers were assessing the trainees from home. So they were pretty safe at their houses. And in this case, both benefited and both were training at their own pace. The trainees went whenever they can, and the trainer were giving feedback whenever they can too. Um, with COVID, what happened was that there was a very important need to train other procedures, such as COVID-related procedures, such as orotracheal intubation, chronopositioning, mechanical ventilation, and the platform started accumulating a lot of inputs, over 6,000 feedbacks. Many trainees were being trained at the same time and receiving feedback from different types of experts in different disciplines. We expanded very fast to the complete faculty of medicine of our university, and everyone was using it. We were not doing the trainings. Basically, the physical therapy area was doing their own trainings. The nursing were doing their own trainings. You can see here how a trainee is basically recording herself with her cell phone and showing this is the teacher's view. So we can see how in Spanish, in this case, they are commenting, drawing in the screen, sending an audio memo on how to improve the skills and how the trainee can basically improve in any kind of mistake that they're committing. So the trainee will receive this on their cell phone, watch it over and over again until they improve and become much better. So if transferring surgical skills is feasible through a platform with validated courses and feedback, why not do it for other practical or technical skills, right? And this is when the startup is born as a concept. So we started expanding to many areas, such as technicians, institutions, where they are using C1 to understand if they can apply, for instance, this electricity circuit equipment. In this case, in gastronomy courses, they are using C1 to give feedback for a trainee at their own home to train themselves to, for instance, attend a restaurant. They are using this to train developers, this full stack programmers that could basically learn very fast from a teacher what is right and what is wrong, not only by being assessed, but by receiving these digital feedbacks that can expose exactly where they're failing. For instance, here the teacher is drawing in the screen saying which kind of function they should improve so that this makes it much more easier for them. In mechanical engineering. And of course, you are now getting the idea that this could help for most kind of skills and how to acquire skills. The concept here is to receive digital skills, digital feedback, digital ways of improving your performance in many, many areas, mechanics and many, many more. So the cycle works this way, right? The trainee is training themselves on a simulator or in anything that they have available. It could also be a non-technical skills. They could be recording themselves interviewing a patient or doing an interview to get hired on a job. And then someone else watches the video of this and gives feedback to the trainee. We also have peer feedback, so that's another benefit. And the video gets uploaded to the cloud. The experts then assess this, give the feedback, it goes back, and this cycle repeats until a learning curve is achieved. The data is being gathered and optimized with now AI, because we are harvesting so many videos. And just to show you the impact of data, so far in the first year of C1 Do1, we had 38,000 inputs of teachers in the platform to trainees in many disciplines. In 2021, over 104,000 inputs of trainers saying where's the mistakes and how to improve these mistakes. This year, we're already over 1 million inputs. So we are having really cool data that is allowing us to publish this kind of results in very prestigious journals, but we're automating different process. In this case, we're automating already this basic laparoscopic course, and it's being taught by our customer Católica University in over 16 cities around the world. So it's easy to expand everywhere. We have even demonstrated that with 2 sessions of C1 Do1, you can really improve much better than the classic intensive workshop of 4 hours where you receive in-person instruction. So remote asynchronous with 2 sessions of 20 minutes is much better than that. So we are basically able now to reach many more trainees, to have access to different types of skills and make accessible so many skills through having different types of customers who are willing to create new content, have their teachers trained, and give feedback to everyone. The lifelong learning is amazing. Imagine you want a specific skill, you're working in a job and you don't know where to get it. Well, through C1 Do1, you basically could apply it to any institution that is training skills and now acquire them remotely. To achieve learning curves and repeat is an essential way to do this. So there are so many benefits that having this technology, or we're talking about basically having access to digital feedback, brings us. So, that we're very, very enthusiastic of the possible results and the possible future of this. The learning is very personalized. Even if you receive peer feedback, you feel this is your own video and how to improve your own mistakes. So it's a very nice way to start having in a mosaic learning. And the concept of mosaic is you take this from this institution, this other skill from this other institution, and in the future, why not have many micro credentials in this kind of concept? So this was just to talk a little bit about what we were doing. And this is only one example of the companies that Chile is offering to the world. I am living in Montreal and I'm expanding C1 Do1 to the US, to many countries, including Canada, of course. And we would love to hear your questions. I'm gonna stop sharing my screen and understand uh, if there's any comments. Perfect. So let me see if anyone raised. If you also want to talk, you can raise your hands. And also, I'm now seeing that many other entrepreneurs from Chile are joining. And you can also, for instance, Alma, if you want to share a little bit about what you're doing and the experience you're having. Also in Nearing, I see Barbara Serrano. So any kind of comment, you are welcome to join us, or you can also leave questions in the live discussion that we're having at the right. just for everyone knows, so in the live discussion, some of the Chilean entrepreneurs, also from the Chile delegation from ProChile, they're leaving some information, and you can uh, watch their decks, their websites, as they are sharing. Also, you can go directly to the delegation area on top of the screen, and I invite you to basically try and get to know these amazing entrepreneurs from Chile that are thriving, doing their best to conquer the world, as we say it, from an entrepreneur world. Um, I don't know if there's any other possible question. Let me see. You can also raise hands and then be able to talk in the chat, and of course during the live discussion. I hope you enjoyed the presentation. It was just an example, and I'm sorry again for this dramatic change of agenda, but I hope at least you get a very nice sense of what is happening from our distant country, Chile, at the very south of Latin America. Great, there's a question. Thank you, Alma. So the question is, what an incredible initiative. What are your ideas for planning scaling with other industries? For those watching, do you think you had an advantage starting out from Chile first, tasting wise? Uh, okay, this is very interesting question. So our plans for scaling is, as an entrepreneur yourself really know, the first thing we're doing is understanding better our product market fit. We know we now have different customers in different niches. Uh, for instance, we're having customers in higher education who, of course, need to train their students using C1 Do1, but we are also exploring having our customers in the healthcare area. In the healthcare area, they need to train their nurses, they need to certify them, they need to train their physical therapists, they need to train many different disciplines and skills. So this kind of customer is kind of different from the higher education. And we also now have different customers in the corporate area, where usually, let's say a company needs to train their sales forces, their salespeople. What they usually do is classic workshops, or they use some kind of digital platforms that will try to make it automatic or automate it, but it's not so easy. With C1 Do1, what we're seeing is that they are recording the sales interviews and then they are improving it with feedback. So every new meeting, what is happening is their sales forces are becoming much better. So in relation to your question, what we're doing is trying to understand which kind of market is a better market for us to expand. Where are we having more impact? How many users are we having impact? Where can we grow with artificial intelligence and automating the courses faster? And for this, basically, we need where are we going to have more data? And also, I think starting from Chile it's a double-edged sword. What happens is it is always difficult, right, to arrive, for instance, to the U.S. When we presented C1 in San Francisco. It's like where is Chile and what are you doing? But in the end, if you have your pitch clear, if you are able to demonstrate the value of what you do, I think usually uh, common people will start understanding that this is a very good technology that can be applied anywhere in different languages, easily scalable. So from a business point of view, we've been very lucky. I think that coming from Chile, at least from a region point of view, is very good, especially in Latin America. So our company is a spin-off of Católica University, and what is happening is that many countries like to follow what Católica is doing, and it has been very, I think we are in the right path to show, for instance, in universities in Peru, in Bolivia, and Ecuador, how things are happening in our country, and they like to follow us, and that's very good for us, of course. But we don't know yet how is the future gonna be, but I hope it is gonna be of a very nice growth and easily expandable everywhere. How about you, Alma? Do you have access to talk maybe, or if not, you can write, of course, in the chat. Oh, I see. No problem. Please don't worry. But thank you for your question. So many Chileans are uh, passing through a different stage of their startups in Chile. We have Startup Chile. We have other programs that are called considered accelerator programs, such as we also have a Corfo, that is our governmental institution who supports and with funds to do R&D in different areas. ProChile also helps us with the internationalization of our products, and it has been a wonderful experience. Well, to start, I've been able to speak here today just because of ProChile. Um, but the one things that we all struggle in Chile, especially old entrepreneurs, is no, we are now facing startups at different stages. We already have some unicorns growing, many early stage startups. It's a very nice market for investors to take a look and understand if they can invest. Many startups are already past product market fit, and they are in their growth stage and trying to scale. Many ed techs, many food techs, many from most areas. And we in Chile are very proud of this kind of ecosystem. We do believe this is a way to make impact to the world. We're very happy that at least the last 5 years have been a very good result for us Chileans thriving in around the world. We hope we can keep this good luck and also to keep this kind of processes going on. Sergio, okay, congrats. You mentioned that you are a spin-off of the university, but how your initiative started? Public funding, university budget, bootstrap, in which stage of growth you are nowadays? Okay, this is a great question. So it's never easy to start a startup. The funds are dramatically reduced, and the access to funds is not so easy. We consider ourselves that we are a scientific transfer product. So usually we were born from R&D research. Usually our research and development is the questions we had were more of a scientific and academic uh, problem. We wanted to solve this type of problems, such as, am I teaching the right way to my surgeons? Is there a better way to do it? How can we get data to improve how we teach surgeons? This kind of questions can be applied, and the funds for to answer this type of questions usually come from a need that is more of a scientific ministry, and usually this type of questions are only seeking not a business model, but more of a problem solving idea, right? But from a research point of view. And once we started realizing that there was value in what we were doing, the methodology could go digital, a product could emerge from this type of questions. Different fundings were needed. Corfo was one of this at a very early seed kind of Corfo. We then had to have our first indicators of product market fit. So our first customers were really well treated, and we keep trying to treat really well our customers. Once you start understanding that there is a willingness to pay for this solution to the needs of so many institutions, well, then you are in a very good moment to raise funds. For instance, in our case, we did a pre-seed with a corporate foundation that was very interested in what we were doing. And for us, it was very strategic because this corporation has over 100,000 trainees. So from an AI point of view, is very interesting. I can collect many disciplines, many data points, understand a lot of how the future of learning will evolve just because this is a large sample to gather data. But for sure, at first, money was always it is always a problem, I guess, especially in our countries in Latin America. I was very lucky that I'm a surgeon, so my bootstrapping was basically doing surgery until I was able to dedicate to this 100%. In which stage of growth I am now, I would try to tell you that we are between a seed and an A series. Even if we have not had this need for raising the money, we are selling, so we're happy that we are profitable, and we can use the money to do more experiments and to invest and to hire my salespeople and to train and to develop capacities such as marketing, understanding how the sales process is happening, how to better improve product market fit. Once we realize that, and if we raise funds, then from a strategic point of view, we would be called an A series more than a seed round, more than a super growth. But of course, from a traditional point of view, also from the amount of money needed, maybe it's gonna be like a seed round. No, thank you, Sergio. Hope also, Sergio, another entrepreneur in Chile. Please, everyone that is assisting this territory focus in Chile, I will gladly welcome you to visit the delegations area in the territory in the Chile area. You can watch all of the startups that are included in our delegation. I hope there's going to be other opportunities for them to show what they're doing. I myself am coaching many startups in Chile, and they are really amazing projects out there. Also, I'm being coached by other startup leaders, so this is a very nice way to develop an entrepreneur ecosystem where we can thrive together. And in Canada, I've been realizing that the ecosystem is amazing. There's many opportunities. So if many Chileans are listening me now, to understand what is happening here in Chile is in Montreal, sorry, is very interesting. The support from the governments, the support from the private sectors, and being so near also to huge markets such as the US is a tremendous opportunity. Please just reach me to try and understand if you can have an opportunity here. There are so many. A very close friend of mine, he's also in this Montreal Connect meeting. He's having a very nice experience with virtual reality technology as a treatment for patients that have had stroke, neurologic strokes. So this is amazing. He's thriving, and he already incorporated to Montreal, and he's been helped by let's say kind of a Corfo. So it's a governmental institution that helps startup here thrive, and it's called Centec. There are many corporations that help here startups, and I found out that the niche here is really awesome to thrive. You can also talk to Nicolas. He's also part of the startup groups here at the Montreal Connect. You can watch his startup at the, as I was telling before, in the delegations area. You go to Chile, and his startup is called Kinestics. Very awesome technology. I've tried it myself. It's pretty cool. And patients that had stroke are now immersed in this VR world where they can play with tools in this VR, and that stimulates the uh, motor skills needed to recover. So it's pretty cool too. I'm eager to, of course, try and understand many other startups from Chile, and also from the rest of the world. I've been attending the rest of the territory focus, and they have been very interesting so far. Well, I think with nothing else to say, we can close in advance this session. I mean, I don't want to stay here only talking by myself, and I'm so happy that we at least had this small opportunity to show that in Chile things are happening. We are growing, not only in numbers but in quality. We know much better than 10 years ago what to do, how to do it. So if there's any investors or any coaches or any interested person in relation to what Chile is doing in the edtech ecosystem, you're more than welcome to contact our delegation and to help us all. Thank you again, everyone. Thank you, Sergio, Alma, for joining us, for the questions, Barbara too. Bye-bye.